With that, I just wanted to welcome the panelists, Ms. Mir Arshia and Ms. Mehta Feroz Ahmed. I will be quickly summarizing it. Let me just firstly introduce Ms. Marita Feroz Ahmed. Marita completed her bachelor's from pharmacy from East West University and has been working as a senior product executive at New Vista Pharma Limited for the past 3.5 years. She is currently in charge of the oral conceptive pill portfolio at Bangladesh first woman-centric pharma company. And next we have Ms. Mir Arshia. Ms. Arshia is a pharmacist from the University of Asia Pacific and has been working in the pharmaceutical industry for 8 years. She started her journey at SKF Pharmaceuticals as product executive in the product management department. She has since worked on diverse portfolio including CNS, non-steroidal antibiotics, and pain killers. Thank you both for being here. And with that, we can quickly start with the video. So we are going to talk to a person having acid peptic disorder, and here, starting with the first question. Quite often, the environment at a place of work may cause peptic ulcer or another such disease like heartburn. We hope your peptic ulcer is not because of this, or does it?
Actually, he is the building manager here, so his work life would not be the same as working in an office environment or so.
Even if he is working in the building, right? So there also we are talking about if that place also he, feel like that, even if in that space too.
এই পরিবেশে যে পরিবেশ আছে এটার কি কোনো কারণ হতে পারে আলসার হওয়ার?
এখানে যদি হয়তো যদি আমি নিজে রান্না করে খাইতাম বাসায়, দেখা গেছে যে আমি তো রান্নার ভালো পারফেক্ট কিছু জানি না, তো সেই ক্ষেত্রে বা বাইরে আমার বেশি খাওয়া খাওয়া দাওয়া হইতো, তো সেই ক্ষেত্রে বাইরে খাওয়ার তো আসলে অনেক গ্যাস্ট্রিকের প্রবলেম বেশি হয়। যেমন আগে আমার অনেক হইতো, আমার আগে প্রচুর গ্যাসের প্রবলেম হইতো রাত্রে, মানে প্রতিদিন রাত্রে আমার বাইরে খাওয়া পড়তো, কারণ বাসায় তো তখন ফ্যামিলি ছিল না, তখন বাইরে খাওয়া দাওয়া করতো, এই বুক জ্বালা পোড়া করতো অনেক। হ্যাঁ, রাত্রে ঘুমিয়ে আছি, হঠাৎ করে বুক একদম জ্বালা পোড়া ব্যথা, তারপর উঠে পানি খেতাম বা অনেক সময় আমি হাঁটতাম পেট ফাঁপা দিয়ে দিত বাইরে খাওয়ার জন্য। কিন্তু এখন হয়, এখনো হয়, কিন্তু এখন তো দেখা গেছে ফ্যামিলি সবকিছুই তরতাজা রান্না করে খাওয়ায়। আর আগে তো দেখা যাচ্ছে একদিনের খাবার আরেকদিন 2 দিন 3 দিন রেখে খাওয়া হতো।
So what he is saying is his family lives here with him, and the family does, his wife does the cooking, and they have a kid. So when the family was not here yet, he used to eat outside a lot, and he used to have a lot of burning sensation and uneasiness in the night. But after his wife came over and they've been having home cooked meal, he is not feeling those burning feelings anymore. However, once in a while, because he has developed gastric, he does have this burning feeling or so. So he drinks water and take small walks, and that's how he solves this problem.
Also, very often patients of acid peptic disorder get sudden pain in the stomach in the middle of night when in deep sleep. So does it happen with you also?
একদম ঘুম দিছে, হঠাৎ করে পিঠে খুব ব্যথা করতেছে, জ্বালা পোড়া হইতেছে, ঘুম ভেঙে গেছে ব্যথার চোটে, এরকম হয়েছে?
হ্যাঁ হ্যাঁ, এরকম আমার এখনো হয়।
কয়বার হয় মাসে?
মাসে এরকম 2-4-5 বার হয় আর কি এখনো।
Yes, he has this severe pain in the middle of the night while he's fast asleep. He wakes up with pain, and he gets it 4 to 5 times on an average in a month.
Okay, and besides this physical pain, can you describe the mental agony you and your family members undergo at that precise moment when the pain stuck in the middle of the night?
যখন রাত্রে এরকম হয় তখন তুমি না হলে ব্যথা পাচ্ছ, কিন্তু ফ্যামিলি মেম্বার তো অশান্তিতে ঘুম থেকে উঠে যায়, বউ যাই কি হইলো এটা সেটা, এই ধরনের ঘটনা ঘটে নাকি জাস্ট নিজে নিজে চুপচাপ ঘুমায় থাকো, হাঁটো, এই সেই?
না, আমি এরকম হলে ওই জায়গাতে আমার ওয়াইফকে উঠাই বলি যে ঔষধ খাই বা আরো কিছু খাবার খাই, যেমন অনেক সময় খাবার খেলেও তখন আবার ওই ওষুধ খাবার কমে যায় আরকি।
কি ওষুধ খাও?
আমি এখন বর্তমানে খাই হচ্ছে জোরেল ট্যাবলেট।
Zoral tablet. And sometimes he eats some fruits or some food little bit or water and then feels good.
Okay, and mentally, does it disturbs anyone in the family and you also?
It worries his spouse a lot, but this is so regular that they're getting used to it. The wife got used to it that yes, this happens.
Uh, how does this midnight sleep disturbance make you feel the next day at place? Like you work in the same building, so even if does it hampers?
এরকম হয় তাহলে পরের দিন সকালে উঠে কাজ করতে গেলে বা হাঁটতে চললে সকালে উঠার পরের থেকে 12টা পর্যন্ত মানে কিরকম লাগে? কোনো খারাপ কিছু লাগে না কোনো কিছু তেমন আর লাগে না?
ওইরকম ওই জন্যে হয়, দেখা যাচ্ছে অনেক সময় যে পেট ফাঁপা দিয়ে থাকে। তখন সকালে উঠলে তো ওইভাবে মানে এটা বিরক্তকর মনে হয়। যতক্ষণ পর্যন্ত ২-১ বার বাথরুম করতে ক্লিয়ার ভাবে না হয় ততক্ষণ পর্যন্ত এরকম একটা ইয়ে হয়।
Say his stomach bloats, uneasiness, and until he has his stool clear, that that gas feeling and uneasiness sometimes is there, and seems that he's been having it a long time, so he's so used to it.
So is it like you have it a long time, so you have been consulting the doctors as well? So how often you have consulted? And even if they have consulted you, doctor might have told you that you have to stop eating spicy food and start eating bland food. How does that make you feel?
কাছে গেলে ডাক্তার কি বলে যে ঝাল তরকারি কম খান ভাই, একটু নরম ভাত খান, এগুলা বলে। আর এছাড়া কোনো কিছু আছে নাকি ডাক্তার বলে?
ডাক্তারের কাছে আমি একবার গেছিলাম গ্যাসের জন্য, তখন বলছে যে এরকম মানে ভাজা পোড়া জাতীয় জিনিস, এইসব জিনিস কম খেতে বলছে, যে যাতে তেল তো গ্যাস ইয়ে হয়, বাসি তেল দিয়ে ভাজা হয় এরকম পুরি, সিঙ্গারা-টিঙ্গারা এগুলো আরকি কম খেতে বলে, বাসি তরকারি এগুলা কম খেতে বলছে। যে তাজা জিনিস বা শাকসবজি বা ফলমূল এরকম কিছু খেতে বলছে আরকি।
Whenever he visited doctor, the doctor specifically told him not to have a spicy food, not to have food which has been cooked and kept for 2 days or 3 days. Always eat little bit, mostly veggies, preferably veggies, and but fresh food, and not with oil which has been used and used and used.
And does that make you feel annoyed or irritated at?
এটা ডাক্তার বলা পরে মেজাজ খারাপ হয় না? এটা ধরে নিছো যে এটাই আমার জীবন, এটা তো হইবই, সবারই হয়, আমারও হয়েছে। আর বিরক্ত লাগে, কিন্তু বিরক্ত কেন হইলো এটা তার প্রশ্ন করে লাভ নাই নাকি তোমার? এই যে
না,
বিরক্ত
এখন
লাগে।
তো দেখা গেছে যে বাইরের খাবার তো অনেক সময় খেতে ইচ্ছা করে, কিন্তু এই গ্যাসের জন্য চিন্তা করে অনেক সময় আবার অনেক খাবার অ্যাভয়েড করে আরকি খাওয়া হয় না, যে না খেলে তো গ্যাস্ট্রিক হবে। ইচ্ছা থাকলেও অনেক সময় খেতে পারি না।
Even if he wants to, many times he get lust, he get this lust to have food from outside, but then he thinks, oh shoot, I shouldn't have oily food, especially oily food or food from outside, because I'm gonna face this problem, this uneasiness. So restrains himself.
My last one, that can you tell me about how healthcare companies have helped you or other patients?
উনি জানতে চাচ্ছে এই যে ওষুধ কোম্পানি গুলা আছে, যে ওষুধগুলা বানাইছে, এগুলা দিয়ে আসলে কি জীবনে এই প্রবলেম গুলা সলভ করা যায়? তাদের মানে কি আরো ভালো ওষুধ বানানো দরকার, না চলতেছে জীবনে এটা দিয়ে?
না, আরো তো অবশ্যই তো ভালো ঔষধ দরকার। কারণ এগুলা দিয়ে তো আর জীবন চলবে না। যেমন এই এখন খেলাম, আবার এইটা দেখা গেছে যে আমার ২ দিন পর আমিও সবসময় কন্টিনিউয়াস খাওয়া হয় না। ১-২ দিন পর আমি খাই গ্যাসের ট্যাবলেট। কিন্তু এমন কোন জিনিস দরকার যে একটা খেলে লং টাইম আবার না খেলে হয়। কিন্তু ওইটা তো কন্টিনিউয়াসলি খাওয়া লাগতেছে।
He still has the same feeling. He needs a wonder drug. He says that every 2 days or so he has to take the tablet that helps him to attend to this gas problem and irritation. And he says that why can't we have something which will give once a week tablet and resolve the issue for a week? Because it's financial issue there is, and there is this time issue, and then every 2 days to have it whenever. If there could be more easier solution than this. Wishful thinking, you know.
We are going to talk to a person having both the diabetes and acid peptic condition. And here I start with my questions. When were you first diagnosed with acid peptic condition and diabetes?
My acid peptic disorder goes way back in 1982-83, long back when I was a representative and was not taking food regularly because I have to travel very long distance, and I would prefer to come back home and take the food. And I used to leave my home, say about 6 o'clock in the morning, and used to return 4 o'clock or 5 o'clock in the evening. Huge gap used to happen. Then I stopped doing that and started taking food in the places where I'm going. The foods were very spicy, and many a times it happened. I never used to able to close my mouth. It was so hot. So after some time, I developed acid peptic disorder, and my God, what a pain I had! Huge pain in my stomach region. I used to get crumpled with pain, and I had to be on leave for 10, 14 days. It is way back. And at that time, nowadays, a lot of medicines are available. At that time, not much of medicines were available. And I used to take those medicines. Not even cimetidine had come to the market during that time. What to talk of ranitidine, famotidine, and other things.
How have these both conditions, acid peptic condition and diabetes also, have affected your daily life and activities?
I had to take meals in time. Number two is that it used to affect my daily way because a lot of sour water, that is the stomach water, used to come up in the mind and mouth, and there was a huge burning sensation in the chest region. That is the reflux. I had that reflux, what we call it in Bengali, talk deku. And really, it is very much painful. And I was unable to sleep also many times because this sour water of the stomach used to pump into our mouth. That was a very big problem for me. That was really affecting my lifestyle. And diabetes, I've diagnosed diabetes recently, say about 2008. I had diabetes under control. And because of the food habits doctor prescribed me, I usually stuck to it.
And also, sir, very often people with acid peptic condition got sudden pain in the stomach in the middle of night when in deep sleep. So, apart from physical pain, can you describe the mental agony you and the family members also at the precise moment?
Usually started happening with me in night. And I was quite scared before going to sleep that whether this pain will be there in night or not. So that was very much agonizing for me. ভীষণ খারাপ লাগতো, মানে ভয় পেতাম আমি. So I was very much terrorized by the thought that I may have acid peptic pain, gastric pain in my night. So that was the really affecting thing. And top of it, many a times when this sour water used to come up in the mouth and used to pain a lot in the chest region, that was quite painful. And you will not unable to sleep with that. You will have to sit. You have to sit with that. Immediately the sour, that water will enter your mouth. So many a times I have to sit in my bed with a pillow in my bed, in my lap, and used to sleep.
And did it affect your sleep later on after the pain subsided?
After the pain subsided, I used to go for sleep. And that used to make me sleep for hours. And next day, work used to get hampered.
I think because you were anxious, it affected your pain more. That's what I'm not sure. Can you just elaborate on that?
The thought itself was very agonizing, and probably there is a correlation between my anxiety and the acidity at night, nocturnal acidity, the nighttime, rattebelar je acidity hoy, that thing used to be very much agonizing. And this used to affect my lifestyle like anything. And my wife and other people in the family used to get disturbed because they used to see that I am not sleeping. I am just sitting and putting some pillows on my lap and putting my head so that it doesn't pain me.
In this acid peptic disorder, the doctor asked you to stop spicy foods and start eating bland food. How do you feel about that?
That spicy food, if you take it, when you are having severe acidity, you will have it. You will really have real pulling the danger. Instead of, if you have something which is acceptable, salt is there, taste is there, so why you require a spicy food? And spicy food, after taking within half an hour to 1 hour, you will have lots of problems. So you are tasting for 5 minutes or 7 minutes that spicy food and you are suffering for hours. That has to be taken into consideration. That you are suffering for hours for that 5 minutes, 10 minutes of food, and you will suffering for hours together after that. That, I'm very, being a Bengali, I'm fond of spicy foods. But gradually, you have to learn that you should not do all those things. And you have to control that 2-inch by 4-inch muscle, that is tongue. জিভটাকে সামলাতে হবে, জিভটাকে না সামলালে কিন্তু এই জিনিসটা কমবে না. We the Bengalis have a problem of very much fastidious about foods, and we suffer a lot because of that. In fact, in my family tradition, there is a lot of spicy food to be taken and a lot of but gradually I have to give it up. And it's a matter of lifestyle only. You change it and you are better. Another thing one must be aware, বেশিক্ষণ না খেয়ে থাকলেই problem. If you do not eat for long period, you will have real problem. So better to take small foods. There will be huge acid secretion and you will have real problem for that. And you will have a lot of medicines. And choice is yours. Take food in between. Small food. You may not like to have a lot of food at a time, but small food will help you. Lot of food will, small food, so that the acid doesn't secrete more. বেশি যেন অ্যাসিডিটি না হয়ে যায়, সেটা দেখতেই হবে, না দেখলে কি করে হবে? ভুগতে তো হবে আমাকেই. I will suffer. Nobody will suffer. Yes, my family members will suffer seeing my pain, but I will have to suffer. That's the thing. That if somebody is sitting beside you, unable to see, that will affect the spouse also. It will affect. Even to my enemies, it should not happen. It is so excruciating, so bad a condition. Nowadays, a lot of medicines are available, but if you have acute condition, God help you, Bhavari, no, what a pain you have got.
And also, sir, if you have received any support in these times, and if so, it has been helpful to you or not, from anyone, whether it's healthcare professionals, family member, workplace professionals, any support from anyone.
My mother used to help a lot. She was a very knowledgeable person regarding this thing. She used to insist that take rest, don't take tension, take little food, and you will be okay within some time. She used to encourage me a lot. Don't worry, nothing will happen, nothing will happen. My wife used to be anxious. But the thing is that, another thing is that my doctor used to tell me that if you do not change your lifestyle, you cannot help yourself. That's the thing, lifestyle has to be changed.
Your final message to the people of Bangladesh.
না বারবার খান, খেয়ে যে সবসময় যে অম্লটা সৃষ্টি হচ্ছে সেটাকে কমিয়ে রাখুন, বারবার খান। আর বেশি ঝাল টাল খাবেন না, মাংস যতটা কম পারবেন খাবেন। মাংসের সঙ্গে আপনি তো বলতে পারেন না যে না আমি ঝাল মশলা দেবো না, কিন্তু মাছ খাবেন, মাছের ঝোল খাবেন। টেক ফিশ, মাছের ঝোল খাবেন, মাছটা খুব উপকারী। মাছের ঝোল খাবেন, মাছ খাবেন, মাছের সঙ্গে ভাত খাবেন, কিচ্ছু হবে না। কিন্তু ওই মাংসর সঙ্গে যদি ঝাল টাল বেশি খান, আবার সেই ইউ উইল বি ইন দ্য সেম স্পট, আবার সেই জায়গায় চলে যাবে। আমার একটাই যে আমিও বাঙালি, আপনারাও বাঙালি, আপনারা যা খান আমিও তাই খাই, মোটামুটি খাওয়ার স্টাইলটা একই। তারপরে আমি আবার আমার আমার পিতৃপুরুষ সব পূর্ববঙ্গের লোক, তো আমি জানি যে what Bangladeshis take and what we take here, food habitটা মোটামুটি একই। বারবার খাবেন, অল্প অল্প খাবেন, বেশি দেরি করবেন না, লম্বা লম্বা গ্যাপ দেবেন না, তেল ঝাল খাবেন না। আর মাছের ঝোল ভাত, এটা কিন্তু খুব পুষ্টিকর। মাছের ঝোল ভাত মানে বেশি ঝাল টাল দেবেন না, কিন্তু এমনি মাছের ঝোল ভাত খাবেন, এমনি মাছের ঝোল ভাত খাবেন। আর আমার ঠাকুমা বলতেন যে রান্না করতে গেলে যে ঝাল তেল দিয়ে রান্না করতে হবে, ভালো রান্না করতে হবে, এর কোনো মানে নেই। রান্না যে জানে সে ভালো রান্না কম তেলে কম ঝালে করে দেবে, সেটা নিশ্চয়ই মনে রাখবেন। হ্যাঁ, আপনাদের অনেক অনেক শুভেচ্ছা রইল আমার থেকে। Lot of good wishes from my side because I have suffered a lot. I am now an elderly person and I would আমি চাই না যে আপনারা কেউ এরকম ভুগুন। I don't want that you suffer with this acid peptic disorders. আমি চাই না যে আপনারা এগুলো নিয়ে ভুগুন। আর কিন্তু একটু চেঞ্জ করলে দেখবেন যে ঠিক হয়ে যাবে। এটা হাতি ঘোড়া এমন কিছু নয়। It is nothing to be great to change yourself and have a happy, comfortable life. এত ভোগার কোনো দরকারই নেই। You need not have to suffer to that extent, which I had suffered because of my stupidness. You need not have to be of that type.
Okay, so let's move on to the discussions. So the question is to both of the panelists. As we see the videos, do you think that these type of insights that we have from the two videos are useful to the brand manager in differentiating their brands from the competitors for preparing positioning statements and position messages? To both of you, starting from me, Ms. Meerash.
First of all, I would like to take one moment. Thank you very much for giving me this opportunity to be able to speak here in front of the esteemed panel. And Vivek sir, as always, I have not be able to be here with if it's not for BU. Thank you, Vivek sir, for the opportunity, and thank you, Pharma State. Acid peptic disease is something that every person, be it from the age of 12 to 90 years, they will face it at any point of their time of their life. And this is so common that we can guess from the booming markets of PPI brands in terms of prescription, in terms of the sales volume that we see. So this is the most common disease, and this is something that we feel for a bit of a time. Like right now, I am very much stressed because I have to speak in front of big celebrities. So I am stressed, and this is triggering the heartburn, and I can feel that I am having a bit of acidity. So yes, stress from the both video we saw, stress is one important factor that triggers. So knowing the triggers which can put you in situations which is uncomfortable for your stomach. And if your stomach is not happy, my dear, your brain is not going to work. So yes, the habits that a person should follow, the habits, the stress levels, the how, when, where, what to eat, what not to eat, this we know, but we don't know from the right sources. If if a brand if my PPI brand wants to endorse the good habits, what food habits should a diabetic person should have, what food habit a arthritic patient should have, what food habit a general patient, a general person aging from 20 years to 30 years should have, what food habit after 35 years a person should have. If I can promote these kind of awareness and put my brand reminder in the awareness post, that gives me an opportunity to differentiate my brand from others. That gives me the opportunity to create a different identity for my brand, which is caring for the patient. And at the same point of time, my brand will give message to the doctors who, as pharma company, we consider our first customers. We also give the message to doctors that we care for your patients. Your patients are our first priority. We care for them. And that's why we're designing every output through our brands for your patients, so that you can serve your patient with a good brand of our company. So that these kind of videos, these kind of insights, what patient wants will help us to differentiate and to design a different set of presentations for our brands, and which will help us differentiate our brands from the other companies or the competitors, I may say.
Thank you. And that is too wonderful that you have put the live example over here. Coming on with Ms. Mahita, please have your insights.
Thank you, Ms. Shazia. Hello, everyone, and good evening. So, as Ms. Arshia has rightly pointed out, I would like to add with her that, in marketing, patient journey is a very hype term for us brand managers. But, but most of the time, we cannot always execute them from a patient's point of view, actually. So from these two videos of patients suffering from peptic ulcer, what I have gathered that actually not only the patients are should be taken into consideration here, the people revolving around the patients, that from both of the videos we heard from them that when they wake up at middle of the night of severe pain, their family members, like be it their spouse, children, or father or mother, they also get distressed or panicked. So the primary caregivers, we can also take them into the whole patient journey, and we can also take them into account. Okay, so if we while strategizing a brand, these types of insights actually helps us a lot and helps us in differentiating us from our customers or competitors. And for future, when we can do this sort of communication in the right way with the right message, it can actually increase access of care to our customers. And by customers, I don't only mean only our doctors or patients. I'm also referring to the primary caregivers who are caring for the patients, who are giving care to the patients at that time. They can be also taken into account. And if we can address it rightly to the physicians and tell them, empathize with them that we are also caring for your patients, we care for what matters to you the most. With this message, then it can surely differentiate us or differentiate the brand from any other brands in the market. So that's it from my side for this question.
Thank you, Ms. Marita. The wonderful insights coming from both of you. Just a little note I want to have, and we all want to have, if we can have one new idea that can be generated after viewing these videos. Ms. Meerasha.
One new idea that I want to after watching this portfolio videos about peptic ulcer disease, I wouldn't say it is for our practice actually new, but something we have seen after during the COVID period, since going to doctor or making myself avail to a doctor was a bit difficult because of the lockdown, or they were not being able to do chambers, or it was very difficult time. And back then one thing got very popularized, that is some online based app or doctors were coming online, or apps were designed so that telecommunication was developed, so that a patient can access a physician's help from the comfort of his home, so that he or she don't need to go out. And I should not say it's after COVID, because COVID is still there, but we have a lot of control over it, but still that somehow stuck with the practice. Nowadays, we also, at some point of time, some patients are a bit difficult. It is difficult for them to go out and seek help from the physician. So we are now more online based. We browse Facebook, we browse Google for help, for aid, that what to do, what not to do. So one idea, I wouldn't say it's completely new, because we have started a practice of it. We can continuously make small videos of physicians that they have to say for their patients, and make them available through our verified pages, that we Escape already do these kind of videos, short messages, that what regarding various diseases at times, various days, like Heart Day, or in recent past we have celebrated GERD week with doctors. We have made an association with a celebrity, a known face, from whom mass people wants to hear or wants to follow that what the celebrity does. So from her, I'm not taking names here. So from her words, it affects people. They try and mimic that, and they try to know. Similarly goes for doctors. There are several big names doctors that it is difficult for everyone to get their appointment easily. But if I can transfer their messages, their key messages, what they want to share with their patients, so with that is accessible through the verified pages, it will help them. So that is one part we want to continue for the betterment of patients. And also see, peptic ulcer disease is something that if I get immediate relief from the bad feeling, that the nocturnal acidity, if I say that, that happens to me quite a time, that I wake up with severe acidity from a very deep sleep. I'm sleeping in a very deep sleep. I suddenly wake up, and I can feel that the acid is coming down from my nose. So it wasn't a very pretty feeling. So this thing, when it's happening to me, probably my GERD condition has worsened a bit. But if I know that the little burning, the little sensations when I had back then, if I drank more water, or if I had changed my food habit, then it wouldn't have gotten so worse. So this kind of awareness also it is important for arthritic patients, that we have seen in previous discussion. It is very important for arthritic patients, because patients and caregivers, when they come along, they discuss, and a lot of things come out of that thing. But for this disease, peptic ulcer disease, this is something so huge, everyone facing it. But when I just have a PPI for 1 and 2 days, then I feel better. So I stop taking that medication. It's not like an antibiotic that I have to finish a course. We don't do that. We actually stop our treatment there. That is some kind of awareness we need to develop, that PPI is also, you need to complete the dosage that your doctor prescribed for 3 months. You need to continue to heal. Your doctor probably have given you another medication along with it. You have to complete that. So this kind of awareness is also we want to create, so that we can have patient group discussion and adhere a day or two from our side. Something we want to do in a mass days, like select Chittagong, Dhaka with big doctors, so that they can have a speech for mass people, and we can also share clippings of that throughout the month or quarter. So Awareness is the key. So we want to spread messages from the doctors for their patients. We just want to be the pillar.
Great. With that, to both the panelists, I want to say it's a comment from Praveen Riku sir, that in detailing of a brand, a story building can be created for expressing acid peptic disorder to the doctor. That is just a comment from his side. And with that, I feel if Ms. Marita has a expression for this question as well.
Okay, I actually second with Ms. Arshia that we need to actually be more involved in creating the awareness so that, you know, as Vivek sir has always told us that brands needs to be promoted, not the molecule actually. So with this type of patient insights, we will actually found something that will differentiate us from others, because with this type of patient insight, we would be able to pull some awareness campaigns or something that will matter to the doctor, because we are caring for his patients, his or her patients, and their caregivers. And as we have discussed earlier, that caregivers must not be neglected, because for whom we are making the medications, for patients we are making the medications, and also they are actually, you know, buying, and we are generating our revenue is generating from them, so we can't actually neglect them. So I will end my speech with saying that for future, our brand managers need to consider both doctors, patients, and also the primary caregivers as our customers. That's it from my side. Thank you.
Thank you, panelists. Very insightful when it is coming from each of you, the panel members. I would like the senior panelists to have shed some light on the discussion we had with the 3 therapy areas along with the panel discussion. Vivek sir.
In fact, I would give this opportunity to Bhupati Roy, sir. Please.
Bhupati Roy sir.
Sir,
we would like to know, we would like to know that how the panelists have performed across the 3 therapy areas.
So actually, for any chronic disease, for this patient education, patient support group is very important. There we need to work along with the physicians as much as possible as a pharma company. And for acid peptic disorder or any acute diseases, that can be done through physicians only. I think there is very little scope to go further for disease awareness. Maybe disease awareness we can do. So Arshia, huh? Miss Arshia.
Yes.
So
Yes,
you
sir.
said this the disease awareness. Disease awareness for peptic ulcer, you can initiate some program, maybe with the help of a doctor or a clinic.
Definitely, sir.
In a Jumma, after the Jumma prayer, you can through physician, you can tell something about disease, the peptic ulcer disease and its management. So the people can know better about the disease and the management. So one side is the disease management, another is the branding.
Brand.
I'm not coming up the branding issue. Branding is different issue here. Yes. Okay. Thank you very much.
Thank you, sir. Thank you so much for this wonderful insight.
One insight I have, Shazia, that I would like to share after listening to all the talks and also our Dr. Basu briefing us about pre-diabetes and diabetes. We wanted to have this exercise to show you the window, how we view patients and how a doctor views a patient. You may have seen Dr. Basu was talking more on the clinical side and had jargons in his speech, which even we were not thinking that he would discuss.
Yeah.
So this is how doctor is treating patients. They are giving information which is simply going over their heads, right? And a patient will come, has nowhere to go when he is asking for help. When a doctor talks about, in a video, I'll invite you all to join us on the 15th also, because in those videos, patient literally says, then I went to a doctor is speaking something which I could not understand at all. It's a cancer patient, and he's speaking his journey. He says, I couldn't understand what he's talking. He's talking metastasis, he's talking this, he's talking that. I couldn't understand. And this makes me more miserable, very miserable. Already I am suffering from a disease. And now the person to whom I have gone to is giving me more things to, learn. So that is the pain that a patient carries when one has a disease. And this exercise was done to show, we are a third party, so we can have a patient video and show it to you. And I understand Bhupati Roy sir mentioning that Pharma cannot directly go to a patient and get those videos. A third party has to be involved, or some doctor has to be involved in doing so, such an exercise. But this was done by Pharma State Academy to show everyone that how a journey a patient feels when he is going through the disease. Doctor is surely there to help, but he gives limited time. Pharma is there to help. It gives drugs, but please think beyond the pill. And that's all I have to say. Think beyond the pill.
Swati, I want to say something.
Yes, sir.
So actually, as a, not as a company person, as a patient, I want from doctors, they will talk my language. I want that. Number one. Number two, I want he will ask me open question and I will tell more. He will listen more and talk less. That is very important. And I want more time from him, even at the cost of some expenses.
Yes, sir.
For example, in psychiatry, there is a practice for psychotherapy, maybe for 1 hour. So they charge more. So in some conditions, patient needs more time. So for busy physicians, they can charge more for giving more time to the patients. So this we want actually. As a patient, I feel that.
I completely agree, Bhupati sir, and I would rather say here lies the opportunity for pharma companies, which a physician is not giving his time, where a physician is not giving support. Companies can do something in the ways that they can understand, they can forge with other organizations. Now, thank you so much for joining us, Bhupati sir, and chairing this panel. Thank you, Marita, Arshia, Dr. Yusha, Animesh sir, and Tanya, and all the panelists who joined us, Tisha, for these exercises. And big thanks to Shazia, Gauravi, and our team, Dr. Nusrat, who created those videos. They took insights, they tried to take insights. They have done a wonderful job at it, and given a lot of time to get those insights. So thank you so much.